Welcome to Continuing Mobile Education for Emergency Medical Services Providers. This is Block 11, Pacemakers, Episode 2, Associated Medical Conditions and Assessment. After viewing this episode, participants will review why pacemakers are used. We'll review how pacemakers function for various conditions, review the normal functioning of pacemakers, and finally review the assessment of a pacemaker.
Pacemakers are usually used for bradycardia. This may be either symptomatic sinus bradycardia, sick sinus syndrome, or high degree atrioventricular block. In addition, in a rare selected population of patients, it may also be used for overdrive pacing to prevent tachydysrhythmias. Pacemakers are typically triggered when there is absence of electrical activity over a set specified period of time. This is normally programmed by the cardiologist that is managing the pacemaker. Typically this may occur in patients when their heart rate drops below a specified rate, typically 50 to 60 beats per minute. When the heart does not deliver its own intrinsic electrical activity, the pacemaker is able to sense this and fires, initiating depolarization of the heart.
Pacemakers are used to treat various heart conditions including bradycardia, symptomatic sinus bradycardia, sick sinus syndrome, and high-degree AV block. Overdrive pacing is used for various tachycardias. It can be triggered when the heart rate falls below or exceeds a specific rate. In the absence of electrical conduction, a pacemaker will fire, causing contraction of the heart.
The presence of a pacemaker should increase your concern for any potential cardiac disease. This may be either ischemic or arrhythmia related. For this reason, these patients should be placed on a cardiac monitor, as this may provide information in regards to whether or not the pacemaker is properly functioning, or whether or not there is any tachydysrhythmia that may be the underlying cause of the patient's complaint, particularly in patients that present with altered mental status or confusion. Patients with pacemakers typically have underlying heart disease. These patients may be on beta blockers, calcium channel blockers, or on digoxin. It's important to get a full list of the patient's medications, as this can affect treatment in the hospital.
Some common conditions that you might find with a patient with a pacemaker is that they actually have had loss of conduction, so their pacemaker is no longer functioning properly. They may present bradycardic or tachycardic if it's a type of pacemaker that helps to control tachycardias.
Due to the inherent nature of pacemakers, a patient with a pacemaker has an increased potential for a history of cardiac disease. This disease could be either ischemic or be an arrhythmia. Patients may have a history of underlying heart disease or conduction issues. They may be on medications such as beta blockers, calcium channel blockers, or digoxin. Patients may present with bradycardia or conduction issues in the event of a problem.
When you have a patient that presents with a pacemaker, you're going to see some high-frequency spikes on your EKG, which is going to indicate when the pacemaker itself is actually firing. And then with that, you should, on a normal ECG, see some sort of response from the heart electrically as far as changes on your ECG. You also want to make sure that if it is a completely paced patient, that you do have mechanical responses as well. So if you see a pacemaker spike, you should see a indication that the ventricles are responding to that, and you should also feel at the same time a pulse that is associated with that conduction.
Spikes on an EKG can occur when a pacemaker fires. If the lead is in the atrium, there will be a spike followed by a P wave, and then followed by a QRS complex. If it is within the ventricle, there will be a spike followed by a QRS that is typically widened and may have the features that appear to look ischemic. If there is a dual chamber pacemaker, leads will be present in both the atrium and the ventricle. There should be 2 spikes noted, one before atrial contraction and one before contraction and depolarization of the ventricle, which is represented by the QRS complex.
As you can see, this is a normal EKG with a normal P, QRS, and T-wave complex. An individual with a pacemaker, whereby the pacemaker is firing in the atria, one might notice a pacer spike just before the P wave. If there is also a ventricular pacer, there will be a second pacer spike just before the QRS complex. Although because the pacer spike is generating contraction in the ventricle, this QRS complex is typically wider when the ventricular pacemaker is firing.
Pacemaker firing may potentially be confused with any widened QRS. For this reason, it is important to look for these pacer spikes and to make sure that they are followed by initiation of a QRS complex.
Normal characteristics of a pacemaker include high-frequency spikes on the EKG. They can be seen before the P wave, before the QRS complex, or in both places. A mechanical response is referred to when a pacemaker spike corresponds to a pulse. Pacemaker spikes can be confused with potential ischemic arrhythmias. Look for spikes with initiation of QRS complexes to rule out possible ischemic arrhythmias.
Some challenges that are with patients with pacemakers is that, number one, sometimes they don't know much about it. They'll tell you that I have a pacemaker, but they don't know if it's a single pacing or dual pacing or whatnot at that point. And then just the matter of that if you have a pacemaker that's not acting properly, the hardest part is actually being able to decide what you're going to do, and you have no control over it at that point, at least in the field for us. Physically assessing a pacemaker is very difficult as far as the mechanical portions of it, but we do have some things that we can do in the field, and that is putting on an EKG and just taking a look at where those pacer spikes are coming in relation to the normal beats of the heart and whether they are normal or conducted beats. As far as physically looking at it, we really have a difficult time. The other way that we can assess it also is to ask questions of the patient and make sure that we know the type of pacemaker that was implanted and when it was, and if they've had any recent problems, can give you some clues as to what's going on. Changing your assessment, number one, is just going to change some of the questions that you ask. Again, you want to ask about what type of device it was, when it was implanted. And then if there's been any problems with it, you might also check with the patient and see if they're constantly fidgeting with the device that's underneath their skin or not. That could, in some instances, cause the leads to become disconnected or move. And then you're going to look at your EKG, and if you can identify where the spikes are coming in, it'll tell you when it's firing and in what sequence it's firing, before the P wave or before the QRS complex. Any patient that has a pacemaker that has signs and symptoms or complaints that are cardiac in nature should always have an ALS assessment done, so that we can make sure that we don't miss any potential causes of their cardiac problems. Personally, I don't think that any BLS person or BLS should transport a patient that has cardiac related complaints and also has a pacemaker. First of all, they shouldn't probably be transporting them anyways because of the cardiac related, but if they have a pacemaker and there seems to be an indication that the pacemaker is not working properly, then they should always be transported by ALS.
Evaluating patients in the field with a pacemaker can be a challenge. Patients may not know the specific information regarding their pacemakers or their past medical history. Evaluate an EKG for the intrinsic heartbeats and also conducted heartbeats. Attempt to get a good history, which includes type of pacemaker, when it was placed, and any recent problems with the pacemaker. After viewing this episode, participants will review why pacemakers are used. We'll review how pacemakers function for various conditions, review the normal functioning of pacemakers, and finally review the assessment of a pacemaker.